Okay. We'll get it. Good morning. Today is Tuesday, December 8th, 2020. This is a regular meeting of the Kings County Board of Supervisors. Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
We have 5 members present. We're ready to conduct business today. Right now, we're going to go to invocation, and would you all please rise for Andrew Cromwell from Koinonia Church. Morning, Andrew.
Good morning, all. If you would just bow your heads and let's pray together. I'm going to begin just reading a short verse out of 2 Chronicles in the Old Testament. It says, "O our God, will you not judge them? For we are powerless before this great multitude who are coming against us. Nor do we know what to do, but our eyes are on you." God in heaven, today we are here to acknowledge you and to ask you for your help and your blessing. And as that king of old prayed nearly 3,000 years ago, Lord, we too pray today. We place our eyes on you. There are many things that we don't have the answers for. There's many challenges that we face. And we find very often, Lord, we don't know what to do. So we turn to you. We're asking today, God, for your wisdom, for guidance, and for rescue. Lord, I pray for the supervisors today, for every department within this county that they represent, and for all of the people of the Kings County. We're asking today that the righteous judge would favor us with his mercy. We're asking for favor. We're asking for your blessing. Lord, for all the business to be conducted in this meeting, help us keep our eyes focused on you. And it's in your name we pray these things. Amen.
Amen. Thank you, Andrew. Okay, follow me in the Pledge of Allegiance. Ready? I pledge allegiance to the flag of the United States and to the indivisible with liberty and justice for all. Okay, very good. We'll move on now to unscheduled appearances. Any person may directly address this board at this time on any item of the agenda or any other items of interest to the public that is within the subject matter jurisdiction of the board. 2 minutes are allowed. Do we have anybody with their hands up? We have one. Tim Dinkins. Good morning, Mr. Dinkins.
Good morning. Thank you for letting me speak this morning. If I understand correctly, I get 2 minutes. Is that right?
Yeah, we don't have a clock running, but we'll let you go however long it takes.
Okay. So I am speaking. First, I'll just say I appreciate how engaged the Board of Supervisors are in this current COVID situation, and I appreciate their willingness to consider the guidelines that are coming from the Department of Public Health and from the governor. I encourage the Board of Supervisors to reconsider the recent guidelines, specifically regarding playgrounds. The city of Moore has decided to cordon off playgrounds with red danger tape, and I'd like the Board of Supervisors to ask, how dangerous are these playgrounds? Is this something that each city needs to make a decision on, or can't we let the parents make a decision about how much risk is involved in children playing on the playgrounds? And why do we have to put them off to follow what the California Department of Public Health guidelines are? As I understand it, for the next 3 weeks, the orders from the director of the California Department of Public Health state playgrounds or limits, but in the same in the same order, it says that outdoor recreational facilities are allowed to be used, and it gives a reason. Outdoor recreational facilities should be used because it helps the mental and physical health of our communities. I wholeheartedly agree with that statement, and I would ask, aren't playgrounds a part of outdoor recreational facilities, why are they being cordoned off? I think the city councils represented in Kings County feel obligated to inform the public that the playgrounds are off limits, but there are other ways to do that than by actually using red danger tape to do that. Can't they put sandwich signs that communicate the California Department of Public Health's orders and let the individual citizens decide whether they want to play on the playground or not? I mean, it really is ridiculous. There may be no one else on the playground. What is the risk if one family is using the playground at a time? So, after talking to the Lemoore City Council a representative, I think they're looking to the Board of Supervisors to have some input on this. And so I would just like the Board of Supervisors to address this. I think if they said in Kings County playgrounds, we are letting families determine how the playgrounds will be used or not, then that will free up to decide how they're going to communicate the California Department of Public Health's orders regarding playgrounds.
Okay, Tim, thank you very much. I appreciate that. The board will take it under consideration, and we appreciate your time.
Thank you.
Thank you. Do we have anybody else, Melanie? Nope, nobody else? Okay, we're going to go move forward to approval of the minutes from November 13th special meeting, November 23rd special meeting, and November 24th regular meeting.
So move.
And also moved by Supervisor Fagundes, also approval of 24th special meeting and the 30th special meeting. We have a motion to approve by Supervisor Fagundes and a second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Okay, 5 in favor. We've approved all the minutes as presented. We'll move on now to the consent counter. All items listed on our consent counter are listed as one motion unless a board member would like to pull one item and speak on it separately. With your pleasure.
Move as printed, Mr. Chair.
Moved by Supervisor Neves, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Supervisor Neves,
Yes.
Supervisor Valley,
Abstain.
Supervisor Verboon,
Yes.
Supervisor Peterson,
Aye.
Supervisor Fagundes.
Yes.
4 in favor, 1 abstention, and that approves. So thank you very much. We'll move on now to regular agenda items, and we're going to go to Department of Finance. James Erb. Good morning, James. Are you there?
I am here. This is Jim Erb, Director of Finance. I have two.
Good morning.
Good morning. I have two routine annual items for you. One is the adoption of our investment policy, and we've only made one change to the policy, and that was so we could include camp as one of our investment options. Camp has been around since 1989, and they were designed mainly to provide safe and secure investments to government and nonprofit agencies. They have about $5.5 billion in assets under management, and we think they're a good, safe place for us to put money that will be similar to putting money into LAIF, which is a state-operated fund with limits on the amount that we can put in there. So that was the only change. That change was reviewed with the Treasury Oversight Committee on November 16th, and they approved the change, and I'm asking for your board to approve our change and adopt the investment policy for the next year.
Any questions or comments?
There are no questions or comments. Move for approval.
Moved by Supervisor Fagundes,
Second.
second by Supervisor Valley. Madam Clerk, please call the roll.
Supervisor Neves,
Yes.
Supervisor Valley,
Aye.
Supervisor Verboon,
Yes.
Supervisor Peterson,
Aye.
Supervisor Fagundes.
Yes.
Okay, 5 in favor. We've approved as presented. We'll move on now to the next item. I think, Jim, you got that one too?
Yep, I've got one other item. And this will be delegating authority to the Director of Finance, me, to make investments for the next year for the county. We're currently, in our last quarter, we had close to $423 million in the average daily balance that we manage. And we invest them conservatively, and our earnings rate was close to 1.3%. We'll continue to follow the conservative investments and the government codes that we're allowed to use for the next year in managing our portfolio. And so I'm requesting that you delegate that authority to me for the next year.
All right, thank you, Jim. Any questions or comments?
Move for adoption.
Moved by Supervisor Peterson, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
5 in favor. We approve as presented. Thank you, Jim. Have a nice day. We'll move on now to the fire department. Captain Lynch.
Captain or chief?
Chief, sorry, Chief.
Man.
Hey, I'll take either one. It doesn't matter to me. Hey, I'm here to thank you, Mr. Chairman, members of the board, Bill Lynch, Kings County Fire Department, here this morning with an updated mutual aid agreement with the Lemoore Naval Air Station. We've had this agreement since 1962, since the base opened, and they have assisted us on many, many, many occasions, especially on 198 and surrounding wildland areas to help us with incidents there. At the request of the Navy, we've been asked to update this agreement. Some of the signatures and signatories that were on the previous agreement, it's been a long, long time since this has been updated. So the only addition to this is that we are, as with all our mutual aid requests now, we're using closest available unit, which is the standard terminology for everything now. So I'm here this morning to ask you to approve this updated mutual aid agreement with Lemoore Naval Air Station for the areas designated within the attachment, which is the entire County of Kings boundaries. So I'd be happy to answer any questions if you have any.
Well, thank you, Chief Billy Lynch. Any questions or comments?
Second.
Moved by Supervisor Fagundes, second by Supervisor Peterson. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, item passes 5 in favor.
Thank you,
Chief.
gentlemen.
Appreciate your hard work.
Thank you.
Okay, we're going to go on now to item C, Human Resources, Henny Ring. Henny, online this morning?
Can you hear me this morning?
Barely hear you.
Can you hear me now?
No, not really.
Let me check my volume.
Talk as loud as you can get. We can hear you, but it's real quiet.
All right, can you hear me now? Can you see me now?
Yeah, I see you and I hear you a little better, yeah.
All right, hold on. Let me see if I can.
Okay, you're getting better.
All right.
There you
Welcome,
go.
Chairman, members of the board, Henny Ring with Human Resources. Today I have an item regarding our Deferred Compensation Oversight Committee, which is seeking approval for a second signer with the National City and County Management Association, which is a retirement corporation, which we call ICMA-RC. If you recall, our background on this a little bit is on January 28th of 2020, the board approved the Deferred Compensation Committee proposal for ICMA as our record keeper for employee 457 defined contributions for retirement. The board authorized that the Director of Human Resources, which is myself, to execute all necessary documents to implement the deferred compensation plan. In June of 2020, the transfer from MassMutual was complete to ICMA-RC. Approving the designation of a second signer is what we're asking for. We're asking for approval. We're asking that you authorize Assistant Director of Finance, Treasury Division, Tammy Phelps, to be the additional signer with myself, Director of Human Resources. This will provide speed and flexibility in responding to requests by IMCA-RC and related entities. Especially in light of the pandemic, we didn't set up a second signer at the time, so we felt that it would probably be best to go ahead and do that now. We have a deferred compensation oversight committee scheduled for next week, Monday, December 14th. And the committee will be considering some investment changes, and so we'll be bringing some of those ideas to the board at a later date. So what we're asking for is approval of a second signer with ICMA RC as our record keeper for the period of 2020 to 2025, and then we're asking for authorization for Tammy Phelps to be the second signer. I am available for any questions.
Everybody got that?
Well,
You're very weak. We can barely hear you, but I think we understand what's going on.
Okay.
So, any questions or comments?
didn't hear, I read it, so I'll move to approve.
Moved by Supervisor Fagundes. Second by Supervisor Neves. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley? Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Okay, 5 in favor. Okay, if you could just speak a little louder, closer to the microphone. As you turn your head, it really gets weak. So I don't know where your microphone's at. Must be underneath the backside of your desk or something.
It's right in front of me.
Yeah, I hear you now, but when you lean back, I don't hear you at all. Like, you move 2 inches, I don't hear you.
Okay, well, next
There you
time.
go. Right
Okay.
there.
All right, thank you.
Okay, next item.
Come from Public Works.
Morning, Mr. Chairman, members of the board, can you hear me?
Yes, sir.
All right, very good. Dominic Tyberski with Public Works. Now, before you this morning to request final approval of encroachment agreements between the county and 2 private entities, Westlands Transmission LLC and Aquamarine Westside LLC, and authorization for the chairman to sign both agreements. In April of this year, your board approved the applicant's request to construct a 230 kilovolt aerial transmission crossing at 4 county roadways. That would be the Avenal Cutoff Road, 30th Avenue, Nevada at the 27th Avenue alignment, and Nevada at the 26th Avenue alignment. Additionally, one 34.5 kilovolt aerial line crossing at Laurel Avenue. The approval was contingent upon the applicant and the county reaching a mutually acceptable agreement, which has been accomplished. In addition to the $1.5 million franchise fee, which covers the 30-year permitted life of these projects, the applicant has provided liability insurance, which they will renew annually and provide proof of that, and an irrevocable line of credit with the county listed as beneficiary in the event we need to revoke the permit and remove the encroachment. So at this time, I'd like to open it up. Any questions you might have?
Thank you, Dominic. Any questions or comments?
Don't move.
Moved by Supervisor Fagundes, second by Supervisor Neves. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes. 5 in favor. Thank you, Dominic. Item 2.
Very good, thank you. So item 2 is a request to approve a right of entry permit and authorization for the chairman to sign the permit. This action is the first of a 2-part process. StormX, as permitted by the city of Hanford, has constructed a mini storage facility on 12th Avenue, north of Kings County Drive and just north of the courthouse property. One of the city's conditions of approval for the StormX development is to connect to the storm drain manhole, which sits on Kings County property just north of the jail. This action by your board will allow StormX to enter county property with certain conditions and restrictions in order to construct the storm drain line, which runs east-west through their property and will run onto the jail property, connecting to the existing storm drain manhole, which is part of the city of Hanford's storm drain system. The second action, which will come before your board early next year, will be an instrument to grant the city of Hanford an easement for the storm drain line and the authority as well as obligation to maintain the line. StormX will pay a one-time fee of $5,000 for this encroachment. And I would also like to mention that the agreement as included in the packet has been slightly modified. I did forward that modified agreement to Melanie, so you should have that in front of you.
Thank you, Dominic. Any questions or comments?
So movement, Chair.
Moved by Supervisor Neves, second by Supervisor Peterson. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
5 in favor. All right, thank you.
Mr. Chairman?
Yes, sir.
I apologize. Do you mind if I just ask one question on the item before that?
Sure.
The one that passed on the non-hazardous encroachment of the public right-of-way?
Sure, go ahead.
Just the one-time,
That's Dominic.
Dominic.
oh, okay.
Yes, I'm still here.
Yeah, this is probably the staff though, but the 1.5 million one-time net fee, was there, I didn't see anything in the background on the proposed usage of that money. Could we hear about that?
So the CAO might be able to speak on that. That does go into the general fund, and I'm not sure if that has been designated for use as of yet.
Yeah, Rebecca, are you on the line?
I am here. Can you hear me?
Barely, you're real weak,
Her either.
just like Henny.
Oh, boy. Okay, I have IT on with me and we're trying to figure out why it's so weak. So hopefully.
It must not be her though, it must be here.
I have IT on the line helping me to see if we can, can you hear me when I'm talking louder?
Yeah, as long as no one else talks, we can hear you fine. So just go ahead and explain what we're going to do with the $1.2 million for the fees from the solar projects.
Okay, so there is no, the board has not designated the funding or anything in the budget for that funding. This is new allocation, so there is no designation for those funds. They would fall into the general fund, and if your board chooses to outline a spending plan, then you would do that at a future date.
So, well, I guess the chair, the question is, so that money won't be touched though until we designate going into the next fiscal year, the next budget come September or August?
Well, I don't think we don't have the money yet, do we?
No, we do not.
Yeah. So you got your money in the pocket, shouldn't spend it.
No, I don't have any ideas to spend it. I just want to make sure it doesn't get spent. That's a pretty big deal. When do we anticipate getting that 1.5 million?
So that was contingent upon this agreement being executed. Now that it's been approved, I would expect within the next 60 days or so, we should receive that money.
So, CAO Campbell, the money will stay put until we go into next budget. This is money that is not going to be moved prior to the next fiscal budget.
Can you hear me better now?
No, we hear you.
Okay, how about this? Can you hear me here?
Yeah, yes.
Okay. Right now, as of right now, there is no fund spending plan for that money. Unless something came to the board and there was a request to spend that money, it would have to go through the Board of Supervisors.
Okay, so the concern on the money staying until the next budget, it doesn't sound like that's a guarantee. So I think we would have a discussion on how we would move forward with that money. Either make a decision now that money, we accept that money to stay put, as you suggested, until let's not spend it till we go into the next fiscal budget versus this money just coming before us on a Friday agenda item and then voting on it on Tuesday. That's what I don't want to happen, Mr. Chair. I'd like to be fiscally responsible with the money and learn more about the reasons why we're getting this money, what areas are impacted by it, what would be the best use of it.
Working on this for 2 or 3 years, right, Dominic?
Close to that, probably a couple of years easily, yes.
Yeah. We don't know all the impact. We got a pretty good handle on what the impacts are going to be. On the transmission lines, underneath the roads, all that kind of stuff. So yeah, I think a study session would be good to have that in there. See what we need to
Okay,
use that money for if it has something to do with the project, or we could use it for something else.
I like that study. So we could direct the CAO at some point to bring this back a study session on the 1.5 million.
Okay, you okay with that, Rebecca?
You know, if I may?
Yes, Supervisor Peterson.
I think, I think we need to be careful because we collect fees throughout the year, and identifying, specific direction for any of the basic fees that we acquire through, the process of our fee structure. It's truly should be used to run the county with a priority. And to take that money and say, we need to spend it here, I agree, but it just, from the standpoint of fees and things that we do on a regular basis, that should go to the operational side of the county. And I think my concern always, and we have a, so-called one-time $26 billion windfall, I guess, from the state this year, that they're going to, designate as a one-time, for one-time projects. But going, beyond that, here we are, we have restaurants completely shut down again in the county. We have, most businesses shut down. And I think it's important, from the standpoint of a budgetary, fiduciary responsibility to use those funds in a manner that's consistent with, how we operate the county. And so, to break out each individual fee and to designate something just, doesn't seem appropriate to me.
I think I could help clarify Steve Peterson's concerns. I'm with you on that. But I'm not saying that I have an idea of where the money needs to be spent. But on to your point of fiscal responsibility here, what I'm saying is, if $1.5 million just hit the general fund, would it not be fiscally responsible for the Board of Supervisors to have a discussion about that versus just letting it hit the general fund and going wherever? That's all I'm saying, that this money came. If it was a fee, like let's say within interdepartment, then I would assume that money stayed within that department, right? That's a fee that comes in. Interdepartment, see where if some of that money flows to the general fund. We have that discussion once a year, at least guaranteed once a year. All I'm saying is this money came in, it's going straight to the general fund, nowhere else. It's one sentence in the background memo. And I felt that it's just fiscally responsible to have a conversation about that. And then I think we would get to the point of some of the concerns you have of, hey, should it be operational? I may be in agreement with that. I'm not saying I have an idea. I'm just saying, let's have a discussion about it.
Yeah. Well, and I don't disagree with you. I think that we do that through our budgetary process, annually. And, this is, although it's a large sum, at one point in time, like, just looking forward and trying to understand, the impacts of what the state's going to face and what we're going to face, and identifying specific issues, for standard fees and the routing of standard fees. It can just evolve into a lot of discussion about should we? I state my piece.
Yeah. I think it's good. I think a conversation is good. I think we need to understand what the project is, the whole project in light, what it's going to take, and then what fees are associated with the project coming into play, and then decide what we want to do with it. I think it's good discussion. We can have it sometime next year when we're not talking about COVID. Right, Dominic?
Well, we might need it for COVID. So I'm not saying it's urgent, Mr. Chair. You're right. February, March, let's bring it back for discussion.
Yeah, this project could be here for a while before they get it finished. So thank you, Dominic, for your time, and thank you, Rebecca. We'll move on now to administration. Rebecca Campbell.
Okay, can you hear me now?
Nope. You got to hold that microphone right to your mouth like you're singing a song.
I apologize. We are troubleshooting on the spot. I'm trying to speak up so you can hear me. I have an extensive update today. Our last update was on November 24th. How do I sound right now?
Sound fine.
We can hear you.
If you want to hold your microphone in your hand, you sound great then.
I don't know. I think
It's the computer.
it's the
so
computer.
I
Okay.
apologize for the technical difficulty. Okay,
It's
so,
probably more of an issue for the general public, Mr. Chair, we don't know the environment other people are in right now trying to listen to this. Maybe we should take a minute and get this fixed.
This same thing happened when we were doing the state of the county.
well, would you like me to keep going?
Yeah.
You hear that, Rebecca?
That doesn't solve the problem, though. And it's not Rebecca's fault. This is, if every user is having
Can you
the issue, it's not
your
her.
video off and just call in?
Yes, I can do that right now.
Okay. Yeah, we don't want to have anything messed up on what you're presenting.
Okay, I will call in right now. Just give me 1 minute.
Okay. I think we got a couple birthdays this week, don't we? Richard, you got a birthday? Today? Yesterday? Thursday. So Craig's older because his birthday's tomorrow.
One day.
Yeah. Don't ever give the guy a microphone free time to talk.
Yeah. Hey.
So you both are 60 or
Close.
close? Yeah.
You can
You can tell. You got more white hair than he does. I got more white hair than all you. You got dark. He must be living a good life, man.
You know, I didn't come here today really to talk about our hair color.
No, I'm talking about
Your hairdresser?
we got free time right now.
Age.
Yeah. Well, it's not old. You're 60.
That's where you're headed. I can tell.
Well, it's not my birthday, so I'm okay. Does she call in on the computer or on how does it work?
Phone. He's gonna call Drake.
On that phone?
Into the computer.
WebEx.
Council's getting nervous with me talking. Yeah, we did the state of the county. Could you hear us on state of the county? Was it weak?
Yeah. It was
weak, huh?
a little bit weak.
I was real loud, but I was on county run merchandise. I was on my own stuff.
Right.
And they said I was really loud.
Yeah.
But, yeah, I don't know what it is. It gets muffled in the translation.
Right. And I don't know if it's the microphones or.
Well,
On the laptop.
on the computer. Yeah.
Mhm.
Well, except that I just got a text from one of my deputies who's observing, and she said they can hear them just fine. So there's something about some of the participants through WebEx that can't be heard. Others are being heard fine. But for the public who's listening, apparently they can hear it just fine.
And the pasture was clear, right?
Does Rebecca need the phone number?
She has it.
All you guys have to do is get hearing aids like me and then
Program it with your cell phone and you're good.
only bad thing, it only goes up to 10.
Hey, Mr. Chairman, where did you broadcast the state of the county from?
My office.
You just sat in your office, they put a camera on you, and
I brought my iPad in.
you had a script, or
No, I
just went through? Oh, man, I missed it. I didn't know that was going.
Yeah, we had 200 or so people listening on it.
Oh, wow. Is it on YouTube?
I don't know.
I don't think it was on YouTube.
No?
Yeah, Joe was on it.
Yeah.
Oh, all
I
right.
did it from her office, I did it from my office, and then,
And then everybody else was in remotely.
Oh, that's cool.
Here, Rebecca, you on the line yet? She's on.
Yeah.
Send her a message.
Rebecca, can you? Oh,
Yeah, we hear you now.
Okay, great. I've been trying to get in. Thank you for your patience this morning. Can
Okay.
you hear me well?
It's all yours. Sound great.
Great, thank you. So this is a 2-week update on COVID-19. We haven't had a meeting since November 24th, so this will cover that period. I'll go through and start by talking about what's happened at the state level. I'll talk about the federal, and then we'll talk about local county operations. Then I will turn it over to Sandy Huddleston. She'll talk about some OSHA updates, and then I will turn it over to Mr. Ed Hill from our health department to give the health update. So starting, going through for state actions, the governor Newsom came on several times this past week. There's been a lot of activity. On December 1st, he announced new assistance for small businesses, including an automatic 3-month extension for businesses filing less than $1 million in sales tax receipts, extending the availability of existing interest and penalty-free payments agreements to companies with up to $5 million in taxable sales, and expanded interest-free payment options for larger businesses. So that would include restaurants, fitness facilities, personal services that have been particularly affected by restrictions on operations due to the pandemic. While the administration's initial program launched this spring to provide a sales tax holiday for certain businesses, it did not generate the interest that it had originally anticipated. So it's unclear how this proposal and this offer will go. He also announced an application regarding the Main Street hiring tax credit, which authorizes $100 million in hiring tax credits for qualified small businesses, equal to $1,000 per qualified employee, up to $100,000 per small business owner. And the applications opened on December 1. He announced on December 1 that there were going to be 327,000 doses of COVID-19 vaccine that are headed to California. And there'll be a phased distribution plan that I'll speak to. On December 3rd, he came back on again and talked about the regional stay-at-home order that would be triggered by intensive care unit or ICU capacity if it drops below 15%. And he talked about the regions. And so there's 5 regions, Northern California, Bay Area, Greater Sacramento, San Joaquin Valley, which Kings County is a part of, which includes Calaveras, Fresno, Kern, King, Madera, Mariposa, Merced, San Benito, San Joaquin, Stanislaus, Tulare, and Tuolumne counties, and then the Southern California region. So with that, if he talked a little more about that and stated that if the regions reach the regional stay-at-home order status, they would stay there for at least 3 weeks once triggered. And they may come out of the stay-at-home order after 3 weeks if their hospital ICU capacity projected 4 weeks out reaches 15%. Then they would go back to the blueprint for a safer economy tier, determined in their case rate and testing positivity rate. Okay, with that, the ICU capacity will be assessed weekly to determine when the order can be lifted. And with the new order is similar to the March order, there are some variations as noted, and I will note those. So Californians may access critical services and outdoor activities. The following sectors must close: indoor and outdoor playgrounds, indoor recreational facilities, hair salons and barbershops, personal care services, museums and zoos, aquariums, movie theaters, wineries, bars, breweries, and distilleries, family entertainment centers, card rooms, satellite wagering, casinos, limited services, live audience sports, and amusement parks. And the following sectors will have additional modifications. Outdoor recreational facilities will go to outdoor operation only with food, drink, or alcohol sales. Overnight stays in campgrounds are prohibited. Retail would be limited to 20% capacity with entrance metering and no eating or drinking in stores. Special hours must be instituted for seniors and others with chronic conditions or compromised immune systems. Shopping centers, indoor operation at 20% capacity with entrance metering and no eating or drinking in the stores. Special hours must be instituted for seniors and others with chronic conditions and compromised immune systems. Hotels and lodging would only be allowed to open for critical infrastructure only. Restaurants only allowed for takeout or pickup. Offices, remote work only, except for critical infrastructure sectors where remote work is not possible. Places of worship would move to outdoor services only. Entertainment production, including professional sports, operation without live audiences. Additionally, testing protocols and bubbles are highly encouraged. The following sectors can remain open when a remote option is not possible with appropriate infectious disease prevention measures, including 100% masking and physical distancing, and that would include critical infrastructure, schools that are already open for in-person learning, non-urgent medical and dental care, childcare, and pre-K. The governor also provided an update on vaccine distribution later in the week, noting that the 327,000 doses of the new Pfizer vaccine will arrive in mid-December. The state's drafting guidelines work group and community advisory committee have now finalized their recommendations who will receive the initial doses. So there's 3 tiers. Tier 1 includes acute care, psychiatric and correctional facility hospitals, skilled nursing facilities, assisted living facilities, and similar settings for older or medically vulnerable paramedics, EMTs, and other providing emergency medical services and dialysis centers. Tier 2 will include intermediate care facilities, home health care and supportive services, community health workers, public health field staff, primary care clinics, including rural health care centers and correctional facility clinics and urgent care clinics. And Tier 3 will include other settings and healthcare workers, including specialty clinics, laboratory workers, dental oral health clinics, pharmacy staff not working in settings at higher tiers. Okay, so the next thing, the governor talked more about the automatic extension of the filing deadlines on the taxes. So for the fourth quarter of 2020 and the first quarter of 2021, the administration will provide an automatic extension of the filing deadline of 3 months for sales and use tax remittances for filers with less than $1 million in tax owed. So for the fourth quarter, that means remittances that would otherwise be due January 31 of 2021 will now be due April 30th of 2021. So the first quarter of 2021 remittances that would otherwise be due April 30th of 2021 will now be due July 31 of 2021, and no interest or penalties will be accrued during that time. Much like the program offered by the California Department of Tax and Fee Administration, earlier this year, the administration will offer taxpayers with annual sales of $5 million or less. They may defer remittances up to $50,000 of tax owed during the fourth quarter of 2020 and the first quarter of 2021, interest-free and penalty-free. The program would begin May 1 of 2020 and end April 30th of 2022. During those who opted for a deferral would repay their deferrals amount in 12 equal installments. Additionally, the program would be available to those entities already in the payment plan established in 2020. So there's a lot of activity there. Let's see. So while these eligible entities for the program, the program has expanded, it's just still unclear how many businesses will use the program because when they did it in the spring, they did not have much use. So we'll see how that goes. Okay, moving on.
Rebecca, any word on property tax owed for businesses that were shut down since March?
No, there's been no update on property taxes. Mr. Erb may speak to that, but I don't have an update on that.
Okay, thanks.
Okay. The state treasurer and the chair of California Health Facilities Financial Authority, Fiona Ma, announced the extension of a COVID-19 emergency help loan program. The program allocated $5 million from the authority's existing Help 2 loan program to this new program and gave their executive director the ability to lend up to $250,000 at zero interest to each borrower that can prove they've been negatively impacted by COVID-19. And that provides evidence that they will use the loan proceeds to address the impact. While the program was initially scheduled to sunset on December 31 of 2022, there remains $4.5 million available for subsequent loans. So I wanted to share that as well. The expiration of that will be March 4th of, the expiration of that loan program will go along with the end of the emergency proclamation. Okay. And with that loan program, eligible health facilities may have gross revenues of less than $30 million, except for the rural health facilities and district hospitals. They have been in existence for at least 3 years, provide evidence of the COVID impact, demonstrate fiscal soundness, and show readiness to proceed. So there are some stipulations with that loan program and rules about it. So I just wanted to share that as well. Okay, moving on. Yesterday, the governor came back on and he announced, I just want to make a note, he announced California Notify, it's called. And that is a new digital tool, and it's aimed to help reduce the transmission of COVID-19. So starting on Thursday, December 10th, Californians can opt in to receive COVID-19 notifications, informing them if they have been exposed to someone who tested positive for the virus. California Notify is a digital tool that can protect privacy and security. It does not collect device location to detect exposure and does not share a user's identity. The tool was developed in partnership with Google and Apple and piloted with the help of the University of California, San Diego and the University of California, San Francisco. And so that's what came out on the press release. I don't have the information of where that tool is, but as soon as I get it, I will share with your board. Okay, moving on to federal updates. There's been activity, there's a lot of momentum going on there. Budget negotiations are ongoing at Capitol Hill as they are trying to figure out a fiscal 21 spending plan and COVID-19 relief bill. And they are trying to get that done by before the continuing resolution expires this Friday. So at this point, it's likely that Congress will need to approve a 1-week continuing resolution to give lawmakers more time to negotiate. And those negotiations are continuing, and there's momentum and support that has grown there. The House is scheduled to vote this week on several big ticket priorities, including the continuing resolution and the COVID-19 bill. So we'll keep an eye on that and report back to your board on that. Let's see. Okay. So moving on to county updates, the county continues to meet. The Emergency Operations Center continues to meet. Mr. Hill will talk about the Departmental Operations Center on the health side. And the county continues to take measures to minimize risk within its own doors. We are continuing discussions with various department heads about trying to get more employees teleworking. So we're increasing our efforts there and working with them to get the resources that they need. Also, we're also monitoring and updating our return to work employee protocols. That's an ongoing basis. So I wanted to let your board know about that. And then I would like to bring Sandy Huddleston, our risk manager, on, and she's going to talk about Cal OSHA for a moment.
Good morning, Mr. Chairman, members of the board, Sandy Huddleston, administration. Can you hear me?
Yes, ma'am. Hear you fine. Good morning.
Okay. I just wanted to update your board on the new Cal OSHA COVID-19 safety regulations that they have imposed on the county. Every employer is required to implement an effective COVID-19 prevention program. pursuant to an emergency temporary standard in place for COVID-19. This prevention plan must include identification and evaluation of COVID-19 hazards, employee screening, correction of hazards, control of hazards, face coverings, engineering controls, meaning our ventilation system, cleaning and disinfecting, PPE, hand sanitizing, investigating and responding to all COVID-19 cases, system for communicating, mandatory training and instruction to all employees, exclusion of COVID-19 cases, ensuring that COVID-19 cases are excluded from the workplace until return to work requirements are met, reporting and recording COVID-19 cases, return to work criteria, investigating and documentation of hazards, inspections and document findings, investigate positive cases and document, and procedures and reporting for multiple and major outbreaks. And while we already have some protocols and policies in place, in addition to what we're currently doing, we'll now have to add these following duties. We'll have to conduct periodic department inspections to identify unhealthy work conditions and ensure compliance with our COVID-19 policies and procedures. These will now be documented and corrected in a timely manner based on the severity of the hazards. We will be addressing the ventilation system to see if it's possible to increase filtration efficiency or other avenues to filter inside air. Develop a separate communication system such as who an employee reports COVID-19 symptoms to and the possible hazards. Procedure for accommodating employees with medical or other conditions that put them at risk. Procedure reporting for multiple and major outbreaks. Provide mandatory training to all employees or county policies and procedures for protecting them from COVID-19 hazards, including benefits that may be entitled to under applicable federal, state, or local laws. And then we'll have to keep records and track all COVID-19 cases at the employer level. All positive cases and possible exposures will be investigated, and the following information will be documented. The employee's name, location where they work, date and time of the COVID case was last present in the workplace, date the positive first had one or more symptoms, their occupation, the date of the investigation, the staff involved in the investigation, the date of the positive test, information received regarding test results, attach it to the documentation, and any locations that the positive case may have been visited while at work during their high-risk exposure period and who may have been exposed, and attach that documentation. Within 1 day of potential exposure, notify all employees in writing who may have had COVID-19 exposure and their union representatives. Also have to notify in writing any independent contractors or vendors that were at the workplace during the high-risk exposure period. So we have a lot of work to do. Our county protocols have been updated, and those will be distributed to all county employees this week. And we are now requiring all employees to wear a face covering while inside the buildings at all times, as well as outside if they cannot physical distance. This is still the best prevention measure for contracting the virus, and I'm happy to answer any questions.
Thank you, Sandy. This is Chairman Verboen. With all that said, would it be possible that the county could come up with a policy and utilize our mobile testing site and say every county employee before they step foot on our county property once a week get tested? Is that something we can do? It's pretty simple to get tested. And, I don't know with HIPAA if we can force our employees to get tested. I know my employees get tested. I know one of my businesses, the manager gets tested and all of the clients get tested so that no one spreads the virus. So it seems pretty simple when you got a free testing site out there that you provide. We should utilize that with our staff. Is that something we can do? I see council looking at me, so probably not.
We cannot mandate them to take the test. We can offer it, and especially if there's multiple or a major outbreak, then we need to offer it to every employee that is in that area.
So is that a law that you can't make someone take a test if they come expose you to the virus?
Let's step back and condition our answer to that. It is true that ordinarily a government agency cannot order their employees to undertake invasive procedures absent a compelling government interest. For instance, a good example is drug testing, random drug testing for truck drivers. That is considered an invasive procedure, even though they don't actually invade the body.
But it's mandatory.
It is mandatory, and that's my point. Because of the extraordinary safety considerations, regulations have been adopted requiring that. Virtually every other circumstance, it's almost impossible to do random drug testing because the employee privacy and agency over their own bodies outweighs the compelling government interest. This is a situation where counties differ. Some counties are requiring their employees to get tested, especially in particular jobs where safety is an issue. If, for instance, the sheriff's office or fire or an agency that has large public exposure, and if they were absent, could impede the county's ability to provide basic public safety, might be a case where you could impose a requirement, but unilaterally across the board, I think it would fail under the current balance between employee interests and employer interests.
How do the prisons get away with that then, Mr. Chair? Because you can't step foot right now in Sadith and Corcoran without being tested. And the employees are lined up at the gate. Takes an hour to get in.
Yeah, they're testing every other week?
Every other week.
Yeah, every other week. I mean, we're asking our community to test, but we're not testing ourselves. How does that work? We're not leading by example. But we're going to go around and we're going to inspect your office workplace to make sure it's sanitary and safe. But we don't have no idea if the virus is there or not because no one's been tested. I myself, I've tested 14 times in the last 14 weeks. I feel I'm not the problem. So at some point, if we're gonna live with this virus for forever until it goes away, if it ever goes away, shouldn't we make some other alterations in our schedule and say, you know what, Monday morning, you got Monday through Friday, depending on where you're working, please take time and get tested. Or we just have, I mean, it's not evasive. I mean, the tests over the last 14 weeks have gone from going up, 3 inches to a quarter inch or an inch. It's not that big a deal. And you know that you're not spreading the virus if you know you're negative. And if you do get it, I know some businesses are testing twice a week and make sure that all of their staff members and their customers are coming in are tested so they can stay open.
In response to that, the board could adopt a direction saying we're going to do this. It could be subject to court challenge. We don't have any points on any cases on point that would say, no, you can't. There are certainly other counties that are pushing that envelope and believe that they have a rational justification for putting the public safety interest above the privacy interest of the individual employees. There's a public health imperative there. With respect to CDCR and the state agencies that are ordering it, particularly where you are responsible for a captive population and they have no choice but to be exposed if the staff is brought in and they are carrying the virus. The CDCR has adopted the position that they have a duty to test in order to protect their captive population. So again, it's a balancing of the government's imperative and the government's interest with the individual interest in privacy and agency over their own bodies.
I get it. I just thought I should ask because it is a concern, and not that I think it should be mandatory, but I think it should be every individual's responsibility to take care of themselves and not to spread the virus so we can get over this sooner than later. So,
Chairman,
yes, Sandy?
Yeah, we do have the right to ask them. If we wanted, we could have them fill out a questionnaire, asking if they have any symptoms every day when they come in. Departments are supposed to be doing a screening with a thermometer every day on every employee that enters the workplace. So to my knowledge, that's all that we can do at this point, but I'll certainly look into it.
Okay, thank you. I think Ed has his hand up right now. Ed, you there this morning?
Good morning, Mr. Chair, members of the board. Can you hear me okay? Is my volume all right?
Yep, you sound good.
Perfect. I just wanted to address a couple items. The state prison testing was issued by a court order. If you recall, early on when we dealt with outbreaks, we had issued a couple health officer orders, and we went back and forth with the state on whether or not our health officer orders could be enforced within their their fences. As you recall, we are not the one who sought the court order, but that's what was instituted there. In addition to that, and I was going to give this in my report, our testing numbers in the county are increasing greatly, which is a positive, and it's a good trend. Yesterday alone at the county complex, the mobile unit collected over 550 samples. So I'm hoping that, a lot of those are county employees given the location. Obviously because of privacy issues, I can't, tell you how many county employees tested or not. But the fact that those numbers have skyrocketed and its location would indicate that that would be the case. Finally, public health is working with RISC to come up with a testing plan for county employees. And to address your concerns about somebody that is positive or exposed and we can't force them to test, the other thing that we can do is force them to quarantine for the 14 days that way, if they do become positive, they don't spread the virus throughout the county. I just thought I'd offer those comments to help clear up some of the questions and discussions earlier.
No, thanks, Ed. I think the discussion needs to be had, so we understand what rights we have. I know some people don't want to get tested at all. I got personal friends that say, I'm not getting tested, but they've been exposed. I think it's just so easy. I don't understand why the problem. But anyway, I appreciate that. And council has their hand.
I just wanted to follow up on what Director Hill just said about being able to order employees to quarantine. Generally, he is correct. The board can do that as a matter of its protocols. However, there are certain departments that are of such essential importance to the county's ability to provide service to the community. I think, first of all, the sheriff's department or the fire department, whereas if we were to order a quarantine of all employees who have tested positive, while that might be a prudent thing to do on the public health side, might be a very detrimental thing to do on the public safety side. It is a very challenging issue for the county at this point as to where its two primary imperatives, public safety and public health, meet.
Okay, thank you. Rebecca, are you done with your presentation or you want to pass it on to Ed?
No, I'm not quite there yet. I have one more update.
Okay.
I wanted to give you an update on Project Home Key.
All right.
So our the second Home Key project, this is the project with King's Triangle Courtyard, which is in partnership with the King's Gospel Mission. This was placed on a funding reservation on November 13th of 2020. It has been discussed with the board, and as a reminder, the King's Gospel Mission applied for the funding on August 10th, and since that time, some steps have been taken to move the project forward. However, due to the lack of funding, the progress has been limited. County staff and the King's Gospel Mission determined that the project as designated could not meet the timeline due to the late award. So the state came in and approved a number of modifications to the initial application, and it included an increase in funding in order to have the project move forward. The approvals from the state for various requests were received on November 19th, and the funding increase was approved on December 2nd. The project will require a third-party contractor to execute the majority of the work, and the request for proposal that was put out to the public, and it will be closing today. We anticipate that if there is a bidder that meets all the requirements, and that the project may be able to move forward, and so that item will be brought back to your board next week with more detail. So I wanted to make a note for that. So that's the final note that I have. I'd like to turn it over to Mr. Hill right now.
All right, thank you, Rebecca.
Any questions? Okay, thank you.
Thank you. All right, Ed, it's all yours.
Good morning again. Thank you, Mr. Chairman, members of the board. I'd like to start off my report, as I always do, by reminding everyone the simple steps we can take to protect ourselves from communicable diseases such as COVID-19. And those are, again, frequently wash your hands for 20 seconds or more. Don't touch your face with unwashed hands. Stay hydrated with water, as a hydrated cell is a healthy cell. Stay home if you are sick. We are still seeing a great number of cases that are associated with individuals who thought they had a common cold, and then it turned out 2 days later to be COVID-19. So again, if you're sick or have any of the COVID-19 symptoms, remain home. And then finally, wear a cloth face covering to protect yourself and loved ones. Our current numbers our current numbers for the county, we have currently collected 101,395 samples. We have 618 results pending. We're currently monitoring 3,293 individuals. Our current total cases since the outbreak began is now at 6,450, unfortunately with 83 deaths. Our total recovered are 4,903. Active cases are 1,253. Our skilled nursing facilities have started to trend up a little bit. We are now at 218 cases with 41 active, 177 recovered, and unfortunately 24 deaths. State prisons continue to also be an issue. Current total cases is 6,431 since the outbreaks began. That's 564 at Corcoran, 3,150 at Avenel State Prison, and Saddis now has 2,717. They've collected 60,350 samples. They have 882 results pending. They have 1,098 active cases. They've recovered 3,679, and their death count has raised again, unfortunately, to 15. Our concerns still remain the same. We're concerned about the healthcare surge that this may cause our local hospitals, as the healthcare that's available at these prisons is at the lower level med surge, and as these individuals become more critical, they will be transported out to our local facilities. So we continue to have those discussions with the prison, with the state, and with CDCR. We continue to watch hospital data closely, and of course, we're seeing increases in admissions locally and throughout the region, both in regular and ICU admissions. As of yesterday, the local hospital had 75 COVID patients. 8 of those were in the ICU. They reported a 55% capacity for their ICU, 82% capacity for their regular patients, and of those, 24 are Kings County, 35 are Fresno County, 16 are Tulare County, and 2 from Kern County. During the EOC meeting yesterday, our Central California Emergency Medical Services Authority representative indicated that the EMS system is starting to see a trickle-down effect as the hospitals become overwhelmed. It takes longer for ambulances to clear the hospitals. This is common during these events, but it's even more robust now given the current situation. There are discussions about opening the alternate care sites. As mentioned before, again, this is a frustrating point for us at Public Health and at the hospitals and at the EMS system, as we made it very clear to the state that we have plenty of room, or the hospitals and the healthcare system has plenty of physical space. It's the staffing that is of huge need right now and not the actual room. In the past, as I had mentioned, when our first surge occurred, it was mostly the West Coast and the East Coast, and the rest of the nation wasn't impacted, and therefore we were able to get a DoD team from the Disaster Medical Assistance team resource that helped our hospital make it through that process. Those resources are more scarce now that the outbreak is occurring nationwide. We currently are still maintaining a 60-day supply of PPE for all of our healthcare facilities. We've also scheduled and we're holding weekly calls with the hospital to work through any surge planning moving forward. The mobile testing program site scheduled for this week, it was at downtown Hanford on Saturday, Quintanilla Church on Sunday. Yesterday it was the Kings County complex, where again we collected 558 samples. So this is positive news that people are getting tested and our testing is increasing. Today it is at Avenel High School. Tomorrow it'll be at Armona Elementary. Thursday it will be at Lemoore High School, and then Friday it is off for its normal day off. We also have received notice that the state testing site at the Day Reporting Center will be open on Christmas Eve and New Year's Eve, and they will only be closed on Christmas Day and New Year's Day, and their remaining hours will be in effect. Our program that is designated to support the essential workforce and their isolation and quarantine needs is currently serving 42 households with a total of 155 households served, and we've had a total of 231 referrals. As our cases continue to increase, it'll be very important that we keep this program going and we find ways to sustain it. Again, as the cases increase, the need to support these essential workforce individuals will grow. And we'll need to find a way to facilitate this, because if they do go back to work or if they moving throughout the community, obviously we are seeing community-wide spread. We continue to work and meet with the Unified Support Team as required by the state. At the last meeting, we asked them to return 10 of the contact tracing staff that they had demobilized a while back, and they are only returning 5 to us, which is, it's not what we asked for, but it is still good news given the amount of cases that we are seeing. We also requested case investigators, but we are not getting those because they indicated that they are not available due to the holidays, and we may have some available after that. We are also revising our workflow to adjust for these new numbers. As the numbers are getting, as I mentioned before, we're currently monitoring a great deal of individuals. We also asked the Unified Support Team to approach the Emergency Medical Services Authority. We know that the state, that agency has modified licensed paramedic individuals to expand their licensure and their protocol so that they can help during this healthcare surge as well as give the vaccine once it becomes available. We thought that it would be good for students to have that opportunity as well. It was reported yesterday that this has been approved, so we're going to be moving forward with this process and working with our local colleges and our paramedic students. However, the MS Authority did also remind us that a lot of these paramedic students are EMT students, and as a healthcare system, or excuse me, licensed EMTs. So as the healthcare system becomes strained, they will also already be busy. Our current numbers for the state metrics this week are our new cases per 100,000 is at 28.8. That's being adjusted down from 31.8. Again, this is because of the amount of testing that we do. As a reminder, in order to meet that threshold, we have to have 11 cases or less a day. And unfortunately, we're seeing numbers in the 130s again on our newly diagnosed cases. Our overall testing positivity is at 9.7%. Our testing positivity in the lowest quartile of the Healthy Places Index is at 8.8%. This means that now all of our metrics meet the blue or most restrictive tier. Our test per 100,000 is currently at 430. Again, that will increase greatly given the numbers we're seeing now. The regional ICU capacity for that new metric that Ms. Campbell brought up is at 5.6 as of today, so that's a very low number. I'm not going to get into that whole process as Ms. Campbell already covered it. Please bear with me as I sift through my report so I don't duplicate any messages already provided. The order, I do need to mention, the order does not modify any existing state guidance regarding K through 12 schools, and schools are not required to close at this time. And this is contrary to what the governor announced in his press conference last Thursday, where his press conference he mentioned, as well as the document that he shared, showed that only schools with existing waivers could remain open, and that's actually not the case. On the vaccine front, again, I don't want to duplicate anything Ms. Campbell mentioned. We are still scheduled, or it's still our understanding that we will receive our first allotment of the Pfizer vaccine somewhere around December 15th or 16th. Our local allocation is 975 doses. And, you know, as mentioned, the first tier that will be receiving this is the acute care facilities, as they are our last line of defense in the fight against this virus. As you can imagine, that facility is a large facility, and almost all the 975 doses will be used at that facility. We are working with them to come up with a vaccination plan for the facility. As you can expect, it's not mandatory that staff take it, so there will be some that will opt out. There's also the discussion on individuals that have already been positive with COVID, whether they will be receiving the vaccine or not during this transition. So we're working through those processes with them. The administration of the vaccine will be a challenge. As mentioned before, we had ordered all of our ultra-low freezers, but as you can imagine, everybody in the nation is ordering them, so our shipment has been delayed. We do have capacity at our local lab, so we aren't going to be in any hurt for the ultra-low freezers, especially as the allotments remain very low at this time. But it will create a challenge for administration since we are administering the vaccine, because we're the only one who has the ultra-low freezers. And once the vaccines come out of those freezers, they're thawed, they're constituted, they have to be given within a certain amount of time frame, otherwise they go bad. The final item that I want to bring up about vaccines is, as you know, it's a 2-dose vaccine, meaning that each individual needs 2 doses. We, again, are receiving 975 doses, And once we've given those vaccines, that will trigger the shipment of the following second dose. That concludes my report, and I'm happy to answer any questions.
Thank you, Ed. Any questions or comments for the health director? Supervisor Peterson.
Yeah, not so much for health director, but just going back to some of Rebecca's comments and Sandy's comments with respect to Cal OSHA and some discussions that I've been a party to with jurisdictions outside of the county, but within the inside the county, but outside our jurisdiction from cities and mutual aid issues with respect to public safety and fire. And, the discussions that I encountered were talking about, if 3 or more employees go down, then that operation needs to close. And so from the aspect of public safety and all of the cities surrounding or within the county of Kings, they could possibly be ordered to close down. And how do I know we haven't had the discussion yet with many of those cities and other jurisdictions about, I know we have, mutual aid agreements and things of that nature, but this could be pretty overwhelming at some point. And just wonder if we have any insight yet. I know I've spoke with Fire Chief a little bit about this, but caught him off guard as well as, some of the planning that was happening in other jurisdictions and hadn't included, the county in those discussions. So any comments would be helpful at this point.
Sandy, do you want me to address that, or do you want me to talk about it? I'm happy to talk about it.
Yeah,
Either
why
way.
don't you go ahead, and then if I need to add something, I'll chime in at the end.
Yeah, so per the OSHA regulations, if there's 3 or more cases, and she can chime into that, is considered an outbreak. So we have had this incident come up, and we've had to shut an office down or a building down and get it cleaned as soon as possible. We've brought in alternative staff members to keep operations going, and we've addressed the quarantining or COVID-19 issues related to our employees. Sandy, if you want to add anything, you can do that.
Okay. I did have a conversation with Sheriff Robinson, and I'm not sure if he's on the call still, but he may be able to better address. We did talk to him about our concerns, in the jail and so forth. He said with patrol, he's able to juggle a little bit better on the schedules where he could, not have as many people together in the jail. It's a little more difficult. And as he stated, he's got business to conduct and cannot shut the jail down. We're doing our best to mitigate that. He's having them wear face coverings, trying to keep them 6 feet apart as much as possible. And he said he is working on a backup plan should something like that happen. So, Sheriff, I don't know if you're on the line and would like to address that.
Hi, Sandy. Yeah, I'm here. Thank you. Yeah, and so I met with all my managers last week, and all of them are putting in protocols within their respective divisions, and then also creating backup staffing plans. And just to give you an example, so I have many staff that once worked in the jail facility that now work either in bailiffs or on patrol. And so we're creating staffing lists for those people that no longer work in the facility, but can go back and work in the facility in case we have an outbreak, in the facility involving staff. And so we're just putting protocols in place to try to deal with any of those issues as they arise. Working, obviously with Ed at the health department. And while it's a challenge when somebody does test positive, knock on wood, we've been fortunate to be able to isolate those people. And many of our staff have, recognized symptoms early on and not come to work and gotten tested, where we've been able to avoid, some major outbreaks. And so far so good. And we're just going to continue to work with Sandy and Ed and try to work through these issues as they pop up.
Yeah, thank you, Sheriff. And my questions, I guess, go beyond the county jurisdiction and not beyond the county jurisdiction, but the jurisdictions within the county, cities. I've heard discussions about, what happens if a fire department outside of county jurisdiction goes down? I keep saying outside of jurisdiction, but if it's a city, a city fire department, a city police department, typically can be somewhat small, and all of a sudden now, there's some expectation that the county is going to jump in and backfill that void. And I think we need to have some discussions with our cities, as to, what their expectations are and how they're going to manage this and how we're going to coordinate, through that challenging transition.
Thank you, Supervisor Peterson. We do have those mutual aid agreements set up, so we will certainly put that on the forefront and talk about how those mutual aid agreements will be navigated through this COVID-19.
Thank you.
Mr. Chair.
Supervisor Valley.
Yeah, thank you, Mr. Chair. Mr. Hill, I have two questions for you. I'll start the first one. The mission that you have, that you continue to have, I know you had a lot of CARES funds and other money sent your way. Is your budget healthy moving forward? Is there anything the board needs to be aware of budget-wise, fiscally, to ensure you have the resources that you need to continue to do your best to protect the health of the residents of the County of Kings?
Thank you, Supervisor Valley, through the chair. Our budget is not looking healthy right now. Ms. Campbell and I are working on bringing an item back to your board next Tuesday where we can outline in detail all of the intricacies of what we're seeing, any possible contingencies, as well as options for your board to consider moving forward.
Thank you. I look forward to that next Tuesday. Mr. Hill, can you also bring any audit of CARES funds for Tuesday, so the board can have that? Could we have that in our Friday package with the agenda? I'd like to see where the monies went, line items, please.
Supervisor Valley, through the chair, I can speak for public health. We can provide that. Ms. Campbell will have to, I don't want to commit her to a Friday deadline if there's going to be any issues for her meeting that or any outstanding item.
Thank you, Mr. Hill. At minimum, I'm not anyone to oppose a deadline. It'd be nice to have that on Friday for study over the weekend. If that's something that comes in on Monday, well, then, we'd have to do some night cramming, but that would be acceptable as well. Mr. Hill, thank you for that. Switching over, Mr. Hill, to the vaccines. Will there be a time where the county, is it acceptable for the county to, if there's vaccines on the general market for purchase, is that something that you would be able to do versus what's being sent down our way?
Supervisor Valley, through the chair, I'm going to restate your question so that I'm sure I understand it. Are you asking if they become widely available and they are available for purchase, would that be something public health would carry for purchase?
I'm asking for the, what do we have sitting there, Mr. Chair? Is it 20K or 25K that Jose Ramirez donated? We have that's 20. And so that's the foundation of the question, Mr. Hill, the 20,000 donated by Jose Ramirez. If there's an opportunity to buy vaccines from the general market, for lack of a better term, versus the vaccines that are coming from the federal government or the state, if there's an ability to purchase if the board agreed in the future to use that 20,000 to do so, is that something that you could do? I'm just asking for the foundation.
Thank you, Supervisor Valley, through the chair, for the clarification. Yes, we have a dispensary pharmacy license. We would be able to purchase the vaccine if that were necessary. As you know, listening to the news, there's a chance that the federal government will purchase the bulk of these. But yes, if it becomes available for purchase and if the funds are available, that is something public health could do.
Okay. Hey, thank you. Thank you, Mr. Hill, and thank you for coming on my social media and doing that update. I appreciate you getting the word out, the videos out there. It's being shared, and people appreciate your clarification. There's a lot of confusion at that time, and probably still is. But for your part, I appreciate you clearing that up. I think it helped locally. Mr. Chairman, I'll be brief here too, but can we just get some general direction, maybe a discussion on general direction? You actually started hitting the point with your first comments early on this agenda item. But moving forward from the point of view from March to now, we are where we are, right? Taking the politics out of it. We all get criticized whether we're being too serious about COVID or criticized for saying whatever our opinion has been. We have all been criticized on it. I'm pretty sure. But moving forward, looking from March to now, clearly we're still in this issue. Some would argue that we're worse than ever before from when this first broke out. So the definition of insanity, right, is doing the same thing over and over again and expecting a different result. And so that being the foundation of my comments here, whether it's today or next Tuesday, that the board, that as local leaders here, that we put out some type of clear, a unified message from the five of us moving forward, something that we could all stand on and in agreement. And to help our county, right? Because we can't take care of everybody else, and there's noise in all 58 counties, and there's noise across the country, and it is a very political messaging now, and it was divisive. The presidential election shows that, right? Just, I think it's fair to say half of Americans believe one way about this virus and half believe the other way. And at this point, we're not going to change anyone's mind. But I think at some kind of unified message, a refresher from the Board of Supervisors out to the general public. And it doesn't have to be today. It's something we could probably work on and speak to next Tuesday, because I think it helps. And I think even for us, the EOC, we've been doing these calls since the end of March. I was going to ask yesterday, but I thought I'd wait till today. What direction could we give the EOC is we sit there on that call, that's an hour out of our Monday morning every week. And then we all go our separate ways. And I believe a lot of us have different messaging out to the public when we go our separate ways. Are we expected as members of that EOC and on that call, are we expected also to have a unified message and move forward as a unit as we try to counter what COVID is doing to this county? Because if we're not, then why are we on that call? Because everything that comes on that call, we could get by email. But if we're going to be on there and share minds and share data, and there's a lot of smart people on that call, I think we have an opportunity where we should and could do better with that.
And I think on that, I think we can't make a decision from the EOC call, correct?
You can't even discuss it.
Right.
Here?
At the EOC on the call. And giving direction to the EOC, I would defer to Supervisor Neves on this, but my understanding is they have an independent legal duty to protect the public health. So the board can make suggestions and ask them to consider things through board action here, but you can't tell them what to do, per se.
What I just said here, I couldn't say on a Monday morning call, huh?
That is correct.
That's why I didn't.
That is correct. And so you are right, absolutely right, to bring it to the board to see if the board wanted to give them some feedback, input, suggestions. But the board can't tell them what to do, and you certainly can't do it on the EOC call on Monday mornings. The Brown Act suspension allows a majority of the board, and I'm saying this more for the public record than for you, I know you know, allows a majority of this legislative body to participate in COVID updates. You can ask questions, you can seek clarification, but you can't make deliberative statements or statements of position or give direction.
Okay.
All been yelled at for that.
Yeah, I'll stop there, Mr. Chair. I know I've said a lot. I'll save some for next week, but maybe to that point on the EOC, that's something we can discuss.
I think the direction of the board is we can discuss it. It's just hard because it changes daily. It may change at noon today from the governor. We don't all agree with the governor. We look at other states and how they're handling it. And every state has other counties. Everybody has their own opinion on it. Half the population believes one way, half believes the other way. No matter what we do, we're going to get criticized. I think it's better to, if I was going to say something for a voice, I would say every single individual is up to him to do the right thing. And they need to make sure that they understand what the right thing is for them. Some may be, if they fear for their life, they want to stay home, that's fine. And some feel, well, I need to get out because I need to be social, then make sure you get tested and get out and live your life. No restriction. But every individual needs to have the right to make their own choice, as long as it doesn't hurt somebody else. So I think we can discuss that next Tuesday. Maybe we get something on the agenda. We can have a working session or something, or a study session on it. I don't know how the board feels about that, but we can discuss it amongst ourselves until next Wednesday or Thursday. And if it's something we want to do, we can tell our staff members and then have it on there or not have it on there. It's a tough place to be in, so appreciate that.
Mr. Chair, I'm sorry, for the public record, I just wanted to say that the acronym we've been using, the EOC, is the Emergency Operations Center, just so they understand.
Okay, thank you. Supervisor Peterson.
Yeah, no, Mr. Chairman, you made good points. And, the dynamic nature of this whole process is so difficult, and I mean, I'm listening to a radio program yesterday, and Senator Borges is on, and asked directly directly of the governor's office, we've had these track and trace requirements and we're shutting down businesses based on some kind of stab in the dark of well, we know that restaurants are causing spread. And so he requested of the administration, and directly of Dr. Gailey, we've been tracking and tracing for 9 months now. You should be able to, there should be a data set that you could draw from that shows where where the transmission is coming from. And they said, no, we don't have any. We don't have any track and trace information. So what's the use of the track and trace process if you're not going to analyze the data? And having said that, and I think the other concern I have is, placing too many demands on the health department at this point. I mean, here we are again in the throes of, a surge. Our health department's trying to respond. Staff, they could probably use 100 people more, So I just hesitate to place a bunch of demands on the health department for, hey, get me this by next week. And I get, we need to monitor the spending and how we're flowing. And those are things that, from 10,000 feet right now, it's okay. But, I think, we're really in the trenches of this fight and funds are challenging, but even more importantly, staff time is challenging. And so I just think we need to be sensitive of, making demands on departments about, hey, finances this and, give me this by Friday. Let's work through the important stuff, and that's the health of our county and our people, and make sure that we're able to provide adequate testing, and if not, how we structure it. But anyways,
I think you made that comment. You had stepped down, Mr. Chair. But I believe Sue Peterson, your comment is reflective of my comment that I asked Mr. Hill, as he said next Tuesday, him and the CAO would be bringing an item back regarding the health department's budget. And it's not sounding like a like it's a bright picture we're going to hear about on Tuesday. And so I asked him, I thought quite politely, I didn't demand, I thought I was quite polite in asking him to bring some kind of a, whether it's a one sheet or a spreadsheet on the spending regarding the CARES funds. And that I think that's something the board should have to consider while we're talking about his budget. And if that's something that would be available on Friday with the rest of the agenda packet, that's the only reason why I called for Friday, because that's typical. And then I even backed up and said, if it's something time-wise that could come on Monday, then let's have on Monday. But I think that's within the parameters of a reasonable request there. If we're going to have a talk about a budget, then let us see some documents on it.
Okay. I know this is expensive, testing. I just, I think that a test is $170 by the time you get it run through the whole process. So we spent $94,860 testing people yesterday this year, one day. So this is major money. The health department's going to need about $4.5 million to make it through the year. So we need to do all we can with our lobbyists and our legislators to find some funding to cover his cost. So appreciate that. Anything else? Rebecca, you got anything else you want to add to it?
Yes, I would. I would just like to address Supervisor Valley's comments and let you know that we are working to show you the whole picture. We were trying to get it together for this week, but there was so much that occurred this past week that we had to navigate through several issues this week. So we want to make sure that it outlines the full picture, and we will have that ready for you with the agenda on Friday. That's the plan.
Very good.
Hey, thank you, Mr. Chair. Mr. Chair, could we close with this at least? Just a simple, whatever we need to do here, but as far as leading by example and reaching out to our fellow employees of the county, could we do something here, formalize the procedure here as simple as that before we enter these chambers that we get our temperature check? That's the Board of Supervisors to staff, the CAO, council, department heads who come in, just to send that positive message that, we're also trying to lead by example, but also to help people feel a little bit more confident in the chambers. And by the way, that's why I open up the door. Sometimes I'm hot. Sometimes I just want some fresh air in here to circulate, but that's why I do that.
Male menopause. There's a book 50. You can get on it.
I just hit 50.
You're at the age, man, 50 years old. It's all down.
Chairman, if I could, just to respond, and as being someone that's been COVID positive, the temperature thing is really out the window now. I would estimate that probably over half of the cases, and probably even further, have no temperature. All the money that's been spent on, airports and those things with respect to temperature, it's not relevant. It's the test that you need to do. And
your French had a scanner. You walk up, even at Palace too.
Hey, I believe you. Can we get Ed's opinion on that though?
Sure.
If he says it's out the door, it's out the door. Then I'm not trying to argue.
No, well, but it may be for COVID, but for common colds, flus, it's always a good idea not to have somebody running around with a temperature. So it's not a bad protocol to have, but I don't want you to have a false idea that it's COVID related.
No.
There's a lot of other viruses and illnesses other than COVID that people can die from.
I understand.
And the temperature screening is just that. It's a temperature screening that gives you an idea of that person's individual health. And it will take further investigation to figure out what the cause of that temperature is. But there are many reasons to run a temperature, from a sore tooth to a ingrown toenail, so anytime the body has an infection, it's going to run a fever. So to think that it's going to be a prime indicator of COVID I don't want to mislead you in that direction, but it is a good indication of health.
Mr. Chair, while we're waiting for Mr. Hill, our risk manager just reminded me that Cal OSHA, the new regulations require mandatory testing for employees. My office, or testing temperature checks. My office does it every morning. People come in. So for compliance, providing a safe and healthy workplace, it's a good protocol to have, just as Supervisor Neves has.
We do it in our office too every day.
Yeah.
Here, yeah.
But it's mandated by Cal OSHA at this
Pass it.
point based on the new regs.
That's the thermometer.
Yeah.
Chairman?
It's one on the forehead, if not anything else. It's forehead thermometer.
Most of the time when you come in from outside,
Yeah.
you're gonna be cool.
Yeah. Ed, we
Sorry,
can hear you.
off mute. I'm available. I'm just going to kind of reiterate what Supervisor Neves mentioned. He's absolutely correct. Any inflammatory response can trigger a temperature. Ms. Burdick is also extremely correct in the fact that it is a Cal OSHA requirement now. From a health perspective, it would be more productive to do multiple temp checks throughout the day. A perfect example is when this all kicked off. One morning I came in at 8 o'clock. I felt fine. Before the 9 o'clock board meeting, I had spiked 102 temperature. So, the regular checks throughout the day and just relying on staff to, notify us when they start feeling that. Most people are aware when they have a temperature due to chills or any other fatigue that they experience. But for temperature checks to be really productive, I would recommend multiple times throughout the day, at least 3 times throughout the day. But again, that's removing all of the Cal OSHA and the other requirements out of it, which I cannot do.
Thank you. I know one of my kids she was testing herself a couple times a day. I said, why don't you just go get temperature check? I'm like, why don't you get tested? I don't want to do that. But now she checks twice a week just to make sure she's safe and takes that, that way, every 3 days you're good.
I think the general public is getting it on testing. That 500 number yesterday, that's awesome for, we started off at like 110 when that was employees, but all you got to do is see the line.
I think our
Those aren't
county's doing
employees
good.
in that
Out of all
line.
58 states, we're way above anybody else. So I think we're doing good. It's a tough situation to be in. So, okay, why don't we just take a 5-minute recess to use the restroom and then we'll come back and do the public hearing. Okay? Very good. See you at 10:45.
They're the mess.
Do we still have all of our folks for our public hearing online and ready to go in 5 minutes?
Or do you feel like,
Yeah, this is Greg, Melanie. I'm here and we're ready with the PowerPoint presentation.
Yeah.
Thank you, Greg.
And everybody's different.
It is.
Some of them have,
How's that?
but
And Melanie, so I also have our applicant and consultants on there with us as well. So it's listed under Sheila Cedarvall.
Hi, Melanie. I'm here. This is Sheila. I have my John Lunch.
Nobody in the house ever had a fever.
yeah.
Five of us never had.
22. And we'll go now to the public hearing from the Community Development Agency, Mr. Greg Gatska. Greg, are you there this morning?
Yes, sir. Can you hear me, Chairman?
Yes, sir.
Good deal. Good morning, Chairman, members of the board. Greg Gaska, Community Development Agency Director. Here to give you a presentation on the Jackson Ranch specific plan. I do want to let you know that we also have the applicant online too, and that's John Lash and Larry Bross, and the consultants that have worked on this, Randy Jackson and Sheila Cedarval. So if any questions come up through your discussions on this, they are going to be available. And so at the end of my presentation, I would like to turn it over to John Lash for a brief presentation from him. But with that, I'd like to now move to sharing my screen with you so I can give you a PowerPoint presentation.
Hey, it worked. Good job.
There we go. Okay. So we'll start with the project. This Jackson Ranch specific plan actually has quite a few components on it, so I'm going to try to keep it as concise as I can for you, because it is going to involve a general plan amendment number 19-01, development code text change number 668.16, and also a change of zone district boundaries number 20-01. So there are a lot of components to it. And let me go back to the application. We actually received this application for a development project back in January of 2019, but I will also share with you that this is a direct result of the policies that we presented to you back in 2010 to encourage economic growth along the highway corridors if there was complete development packages that could actually be provided the full suite of services. And so that's why it's taken several years working with the property owner, and really the last 3 years with the developers, the applicants on this, to bring everything to be considered by your board today. The project site is 415 acres and involves 3 assessor's parcel numbers that they're on the screen there for you. The properties are located just west of Interstate 5, south of Utica Avenue, and lies in between Interstate 5 and the California Aqueduct. They're currently zoned for general agriculture 40-acre minimum, but they're not under Williamson Act, which is good that we don't have any restrictions on that. So in a nutshell, this proposal is looking at proposing that whole entire site under a specific plan and done as a master planned commercial development to really leverage a lot of that highway commercial traffic that's on there and catering to a lot of the existing travelers. And the specific plan is a little bit of a different approach, but I'm going to show you really quickly the location of it. Here you can see our county and Interstate 5. We really only have 2 interchanges on Interstate 5. The main one that we all know about, Kettleman City with Highway 41 and Interstate 5, already has commercial development, but we have Utica Avenue and Interstate 5 where we have another interchange that was never developed for commercial activities. And so with the Jackson Ranch specific plan, we are looking at new highway commercial that would be directly utilizing that off-ramp that has no commercial development on it. So one of the things that we have to do as staff is anytime there's a land use proposal that's going to change the land use dynamics, we have to look at as to whether it's consistent with our general plan and the policies that you as a board set. And like I mentioned, in 2010, we do have policies that you adopted that do encourage economic growth along the highway corridors, so long as we have complete development proposals and they can be provided adequate services. That interstate interchange is underutilized, but one of the benefits is that it's located in the federal opportunity zone. So that's important for economic development because it encourages job growth in those by providing business incentives for any of the development that happens there. The proposal in its total development would possibly generate 2.4 million square feet of commercial space potential along that interstate. So this is a little bit of a different approach. This is a specific plan that our county has never really looked at in the past or had a proposal for. So specific plans are a little bit different, and so there are different statutory requirements that go along with that. We have reviewed the entire plan. It does meet all those statutory requirements, and so we have a bulleted list there for you, things that it has to include, such as the land use plan, the infrastructure, the plans for services and facilities that will be on there. It has to have development standards, conservation for natural resources, a plan for implementation on how those permits will be processed and the regulations that go along with it, financing measures for how all that's going to be funded, and then it has to be consistent with our general plan and our zoning. So the difference in this approach, you're familiar with the general plan, you're familiar with our zoning ordinance, which is the development code. General plan basically serves as your land use policy for the county, and your development code serves as the regulations for how that's implemented. A specific plan can be added to all of that and actually serves as almost a small mini plan for a specific area. And the proposal in here with the developers is really to create this whole entire new design policy area so that the developments that happen there are conducive to one another and create a whole look and feel for that master plan development. In order for you as a board to approve this, though, the specific plan has to be adopted by resolution so that it serves as the policy document like a general plan, but then it also has to be adopted by ordinance so that it serves as the land use regulatory document as well. So that's why you see a whole bunch of different components presented to you today to make sure that we're integrating that completely into your general plan and development code. The Jackson Ranch specific plan, here are all the different components that are in there. You're provided a copy of that. It has 5 different chapters plus appendices that include all of the land use plan, all the development standards, the administration on the processing, the design guidelines for the look and feel of what the actual structures will look like, and then extra appendices that support that development. The 3 new land uses that will be created as a result of the specific plan, there's 3 of them. Commercial thoroughfare on 27 acres roughly, and that is really the first phase of development. And I'll show you a little more details in the following slides. Innovation Center is 114 acres, and that's what you see in the next map. It's a larger area, and that's looking at commercial, light industrial, transportation, other oriented businesses that could be generated there. But those are in later phases. And then a majority of the rest of the acreage is actually in specialty agriculture. It's looked to continue agricultural production, but allow other agricultural related businesses to be generated in that area that are going to be compatible and conducive to the rest of the development where you have the commercial and light industrial operations. So here's a map of that. The first area that I mentioned is in red. That's the first phase. The Innovation Center is in the purple, and then the specialty ag is in the green, which they intend to maintain in agricultural production, but also have the ability to have either a winery or a fruit stand or other things that are agricultural related and also complement the rest of the commercial development. So there's kind of a breakdown of the first phase. The 27 acres of the commercial thoroughfare are really focused on the highway travelers with food, lodging, service stations, and a truck stop. And I'm going to show you a layout, a conceptual layout of that development proposal. The later phases, the Innovation Center, again, they're looking at other commercial, office, and light industrial, and then the specialty ag. So those are your 3 land use categories that are proposed in the specific plan. There's a blow up of the first phase. All the areas in red would be that first phase of commercial thoroughfare. And here is a conceptual layout of the restaurants, the hotels, and the truck stop that can be accommodated on that. And that really is the primary focus of the developers, to get this part fully operational and developed as the first phase. There's integrated design standards. So the applicant has really done their due diligence to make sure that there are guidelines for what the buildings and the facades and the structure and the landscaping is all going to look like. So there's a whole appendice on the design guidelines. This gives you a couple of images to give you an idea of what that looks like. So now we get down to services. One of the most important aspects of this project and working with the applicant is they have Table A surface water that is associated with the agricultural production on there that they actually wanted to vote to maintaining locally. And that is an arrangement that's been worked out with Kettleman City Community Services District. As staff, we believe this is a real good positive, not only for the development, but also for the community, because the applicant is looking at devoting 156 acre-feet of Table A water to the Kettleman City Community Services District. So if you look at how much water that the development's looking at needing, about 31 acre-feet for the first phase, total of about 47 acre-feet at full build-out. So that still allows excess water to be supporting the existing community. So that as staff, we believe that's a real good positive for not only the community, but helping to create extra economic development for the county and sales tax generation. In terms of the sewer system, they're looking at doing a private wastewater collection and treatment system on site. Same with the stormwater. In relation to the circulation, the Utica Avenue and 25th Avenue would be county maintained right-of-way within the roadway. Everything else outside of that and the local roads would be privately maintained. And so they're going to have a business association that will help support and fund that. Solid waste would be integrated with the regular Kings Waste and Recycling Authority services that are provided. And so here I'm going to quickly kind of go through some of these maps so you can see what I was mentioning with the circulation. Utica Avenue up on the top. 25th Avenue would actually be realigned to move it farther west away from Interstate 5 so that there's less congestion on the on-ramp and off-ramp at Interstate 5, and it has to meet the Caltrans standards because that for distance because of the proximity to Interstate 5. So that has all been aligned for meeting Caltrans standards to move that, and there would be a roundabout that would be at 25th Avenue and Utica Avenue. The city water system that would be integrated would ultimately tie the Kettleman City Community Services District, and that would have to be the infrastructure line that goes up 25th Avenue to connect to the rest of the district. The wastewater treatment facility with a treatment facility to the southeast corner of the property with all the connection lines. And then we have a stormwater system that would be similar, and then also have a facility that is located in the southeast corner as well. So anytime we're doing a large development proposal like this, we have to comply with CEQA. So we have had the California Environmental Quality Act processes done. We conducted an initial study, notice of preparation, and that was out for public comment back in August of 2019 through September 29th, 2019. The final environmental impact report was also submitted to the state clearinghouse, and we had public comment from July 30th, 2020 through August 14th, and I think that's a typo. June 30th, Chuck's correcting me here, June 30th, 2020 through August 14th, 2020. So that's a typo. In relation to preparing that, a mitigation monitoring and reporting program has been prepared for your consideration to help minimize some of the impacts from this future development. And then there is also a statement of overriding considerations that's been prepared for your consideration as well, since there are three significant unavoidable impacts that relate to air quality, greenhouse gas, and transportation. So now as staff reviewing this to make sure that we have consistency with our existing general plan and development code, I'm going to briefly kind of summarize for you the changes that staff is recommending to maintain that consistency. So in relation to the general plan, We have a bulleted list there of different items for you that we would like to change. They're all basically to reference and integrate the specific plan into the general plan. So we would like to add the Jackson Ranch specific plan as Chapter 15 of the general plan, and then also amend Section IC to add a reference to that plan. Land use goal D1 to identify specific plans to be used for community districts. Land use objective D15 to add specific plans in there. Land use policy D161, same reference. Land use policy D163 to integrate specific plan for allowance for urban growth in districts. Land use objective D17 to integrate the specific plan as establishment within a district. Land use policy D171 to incorporate the Jackson Ranch specific plan by reference. And then we also have the land use map figure LU-11 that will now identify the Jackson Ranch as part of the map. And you can see the map here. Down towards the bottom, there's a reference in a blue area that you can put on. You can see where I'm putting the highlighter. You can see the blue area down here. That's the Jackson Ranch reference that would be on that map now. So that covers the general plan. The development code would also have to have changes, and these are staff recommended changes as well. We would like to add the Jackson Ranch specific plan as new Article 26 within the development code. Also add that to the table of comments or contents. Section 102 would be added with a reference to the specific plan regulations. Section 107 would also reference the specific plan for interpretation relevance. Section 201 would refer to the zone plan being consistent with the Jackson Ranch specific plan. Section 306 would add the specific plan as a reference for land use and zone districts in that plan area. And then also Section 2601 would add a descriptive reference for the Jackson Ranch specific plan. So the last component of this is the zone district boundary changes. So we're also requesting that the board consider amending our zone map number 301 that would add those three land uses in there as the relevant zoning for how the regulations apply to the land use on it. And then that comes down to our recommendations. So we are asking that the board hold a public hearing and then consider certifying the environmental impact report for the Jackson Ranch specific plan. Also, General Plan Amendment 1901, Development Code Text Change number 668.16, change of zone district boundary number 20-01, and approve the CEQA findings of facts and statement of overriding considerations and that mitigation monitoring and reporting program. Next, find that the Jackson Ranch specific plan, General Plan Amendment 1901, Development Code Text Change number 668.16, change of zone district boundary 20-01 are consistent with one another and the policies of the 2035 Kings County General Plan. And next, approve the attached board resolution that would adopt the Jackson Ranch specific plan and General Plan Amendment number 19-01. And the next item, approve ordinance number 668-2-20 to adopt the Jackson Ranch specific plan, Development Code Text Change number 668.16, and change of zone district boundary number 20-01. That concludes staff's presentation on this, and I will be available for questions, but right now I'd like to turn it over to John Lash, who would like to give you a brief presentation.
Okay, before that, the sheriff has one security question he'd like to ask you, if that's okay.
Sure.
Sheriff Robertson, you online?
Yeah, thank you. Greg, great information. And it may be premature, the question, and so I just kind of put it out there. Is it possible as this, if this all gets approved, to have, because of the remoteness of it, obviously, our staff wouldn't necessarily be in the area all the time. Is it possible for the ingress and egress areas to request some like security cameras for those areas to help with kind of monitoring for safety and security out there? Or is it too soon to kind of even have that discussion?
So Sheriff, to answer your question, I'm sure that the applicant's going to be open to those ideas. So I think in concept, it's probably something they can address with you right now in concept. As we start getting into the actual development, because there's going to be a lot of infrastructure that has to be put in first. Then once the actual construction of the facilities and all that are being done, I'm almost certain that it's going to be in their best interest with all the businesses that they are doing under a master plan development, that safety is going to be highly on mind and conducive to really what we're seeing now. Once you get into the details of what they're talking about with their development, is really new post COVID-19 era accommodations and integration with their development. So I'm sure safety is going to be in mind. I'm sure John Lash could probably address that better than I can in more detail. But I think he'd be the best to probably answer that.
Thank you.
Okay, thank you. So we'll go ahead and turn it over now to John Latch and your presentation. Thank you.
Chairman and the board, thank you for taking the time to review our project. Sheriff, to answer your question, these days, almost every business has cameras, and as Greg pointed out, probably have, cameras throughout the project. We see a lot of value in that as well. And so, with, technology these days, I think, we'll be up with modern technology and have plenty of visibility that way. I just wanted to take a minute. I one of the partners in this partnership, and just wanted to let you guys know how excited we are about this project. We see a lot of interesting, opportunities here, not only on the commercial side, the first 25 acres or so, but we've also got 90% of the project in industrial, and see a lot of good possibilities there. And would like to, commend Greg Gatskin and Chuck Kenny. Our partnership has developed land throughout California for over 30 years, and we have never had a group been able to work with Greg and Chuck. They're just phenomenal, and I hope you guys appreciate them as much as we've appreciated working with them. And we hope to get an approval on this project because we are really excited to get going.
Very good. Thank you for the comments from Greg and Chuck. That makes us feel well. Okay, at this time, we'll go ahead and open it up for a public hearing. So at this time, we're going to conduct a public hearing, and I'm going to read all the stuff on there, right, Lee?
Yes, please.
Okay, so we'll conduct a public hearing and consider A, certifying the environmental impact report for the Jackson Ranch Pacific Plan, General Plan Amendment number 19-01, Development Code, text change number 668.16, and change zone district boundaries number 20-01, and approve the CEQA findings of fact and statement of overriding considerations and mitigation monitoring and reporting program. Item B, finding that the Jackson Ranch Pacific Plan, General Plan Amendment number 19-01, Development Code, text change number 668.16, and change of zone district boundaries number 20-1 are consistent with one other and with the policies of the 2035 King County General Plan. Item C, adopting a resolution adopting the Jackson Ranch Pacific Plan and General Plan Amendment number 19-01. And item D, adopting an ordinance adopting the Jackson Ranch Pacific Plan Development Code text change number 668.16 and change of zone district boundaries number 20-1. And at this time, the public hearing is open. And do we have any written comments on this, or do we have anybody on the phone? Melanie? And Lee, we don't ask any questions at this time, do we? We just wait till we close the public hearing and ask questions? Either way.
So once you close the public hearing, then the board may begin its discussion.
So seeing we have no written comments and no phone comments on the public hearing, we'll go ahead and close it and bring it back for discussion amongst the board. So at this time, the public hearing is closed, and I'll entertain any questions. Supervisor Peterson, you have a hand up.
Yeah, thank you. So Chuck, with respect to, the development in an unincorporated area, numerous questions and an experience in the Armona area, some challenges that presents and responsibilities. Is this considered an HOA or self-maintained facility?
Supervisor Peterson, this is Greg Gatka. So in a specific plan, there's a proposal for a business association, and John Lash can probably give you more details on that because it will be separate from the county's administration over that, but it is tied to their funding, it is tied to their maintenance, and how that fits into their whole master plan development that will ultimately have various businesses located there. So if John's online, he can probably address that.
John, did you hear the question?
Yeah, no, I thought we had to get off of mute. Basically, we're going to have a community HOA, so to speak, which will maintain all the, landscaping and keep the parking lots clean and everything else. And the tenants we have lined up so far have been very receptive of that. I think they're wanting the same, level or standard of maintenance as well. So to answer your question, yeah, we will have a maintenance district in place.
Well, thank you. With specifics, so, one of the challenges for us is road maintenance, the cost of road maintenance, the continual increase in cost to maintain roads, and based on the master plan commercial side of this, it'll be pretty heavily truck traffic, dominated by truck traffic, and that tends to degrade roads rapidly. In past agreements with the county in the unincorporated areas, not addressing road requirements has been an issue, a costly issue, and does it also address or contain road maintenance as well?
Greg, I think clarified, but I believe the internal roads would be the developer or our responsibility, and then Utica and 25th remains, I believe, with the county. But this project is estimated to, generate substantial sales tax revenue, which should more than cover the costs of maintaining the roads that stay with the county.
Yeah, I wouldn't argue that at first build, but as things transition, you may pull from Kettleman City, you may not, but anyways, that would be my first concern is the cost of road maintenance and maybe not being addressed in here, and I personally would like to see that as part of the HOA requirements, but and then secondly, 31 miles from the closest public safety facilities. There's no plans for anything in the area with respect to housing, public safety, or providing facilities for public safety.
Well, we've addressed all that in the EIR, and we are not going to have any housing. This is strictly commercial and industrial zone property. at one point, I think we had discussions with the highway patrol about possibly if the airstrip were to go in, providing a heliport or transport at the airport. Because there is a long stretch of the 5 freeway where they could really benefit, from having that. Short of that, I think we've addressed everything in the EIR.
All right, thank you. And then I guess for Greg, just from a level of consistency, we've had previous applicants and obviously a much different approach and actually creating a city. And I know there are a lot of distinguishing features, but I just want to make sure that, based on this applicant's application and the previous applicant's application, that we're being consistent. We're asking for, proposed general plan modifications based on at least at this point, solely on this specific location. And would you address that, please?
So Supervisor Peterson, I think you're referring probably to the past or former Clay Valley project that was a whole entire new city proposal that we were reviewing and processing. If I'm correct on that, this is very different because this doesn't involve houses. It doesn't involve a whole entire new city concept. Really what we've been looking at with leveraging more highway commercial activity. Again, it can only be supported if it's consolidating with services that already exist that have a standard that can be met under the state's clean water requirements, and there's no residential component on there, because that really becomes a big game changer in terms of the land use and all the other service needs and everything that go along with it. So this is a little bit different. It is what we're looking at here with a specific plan is a full picture of a proposal on everything that they're anticipating with their development, with the integration of agriculture and how that would be phased in with services. That other proposal that involved a much larger vision, bigger city, really never ever fully got off the ground because it could never answer the key questions of where's adequate water going to come from, how is all the funding on all the highway off ramps and everything else going to be integrated. This one, as staff, in our opinion, has addressed all of those concerns because it's much smaller in scale. It has all the services. It has a whole bunch of different plans that are integrated in there that are addressing everything that we've identified to the applicant need to be addressed to go forward.
Okay, thank you. I don't know if Public Works is on the line, but just their input. We on a regular basis have to review pavement quality and manage that. From the standpoint, I recognize that this is 400 acres, but again, being or representing Armona, I know we've had, a lot of discussions about how we manage and pay for the pavement in these types of single type of operations with respect, in Armona, a lot of housing developments, less heavy truck traffic. This is going to require, I think a lot greater review of pavement management in the areas and how we cover those costs. And any input?
Yes, good morning, Supervisor Peterson, Dominic Tyberski, Public Works. So Public Works did extensively review the application. One of the items of concern was to make certain that all of the interior streets were designated as private and were to be maintained by the business HOA, which was agreed upon. Additionally, any and all landscaping needed to be outside of the public right of way and again maintained by the developer. So as was stated, the only roads that will be the county's responsibility are 25th and Utica. And those are currently county maintenance responsibility. You're correct in that this development is going to generate a significant amount of additional traffic. The roads are being designed to handle that traffic. And with the additional, or with the money that we received or receive for the maintained mileage, we're comfortable that we can provide the level of service required over the lifetime of the project.
Yeah, thanks for the clarification, because I was a little confused about, if there was an actual HOA. I didn't quite get that through the discussion, but that's good to know, and I think important in my review of the process. And I guess I would just close with, my concerns. Kettleman City's kind of out on an island already. If we have to roll on something, whatever it might be, out in 31 miles, then we're talking about backfilling the station, and that has to come from another pretty distant area. And that's just speaking, with respect to fire, from the sheriff's department. I have some concerns about location and backfill and coverage of this specific area. So at this time, that's the majority of my questions, Mr. Chairman.
Okay, thank you. Any more comments or questions? I know for myself, before I was on the board, there was an Easy Trip Travel Center 19 fuel network outside on Avenel Cutoff Road and 269, and Kings County did not get it. But yet the roads are ours that get to it. So this is good. This is a privately owned center that will be managed by a family and run by a family. I consider it like a shopping center. The tenants that rent spaces will pay a CAM charge, and they'll cover the cost of the repairs in there, and we'll generate revenue from it for our county. So I think it's a good deal for all. I think it's great. It's going to offset the cost of the Kettleman City water treatment facility, take away some of the responsibility to the tenants, the people that live there in that community. So they'll use some of the water and help pay for that. So that's really good. So I look forward to this. I think it's great. So any more comments or questions?
Yeah.
Bud Riley, you got one?
Yeah, thank you, Mr. Chair. Appreciate all the comments so far on this. Mr. Chair, I also want to thank Mr. Gatska, Mr. Kenny, and the staff for doing the work and getting us prepared here, and a nice presentation for the public hearing. And I want to thank those involved with this project who made me aware early on. I don't even remember who it was, but it's probably back in 2010, 2011. I got a call about this project, and we went out and we met at the Utica exit off I-5, and we parked there and looked over this empty lot and talked about the future and given me a description and a vision of this project. So I'm glad to see that all this work's been done and some things are coming to fruition here. I think at the time, the reason I was reached out to is because I was being very vocal about the West Side, and very vocal in regards to Kettleman City, and with the redevelopment agency being in place at that time, I was vocal about the opportunities in Kettleman City and at the junction of I-5 and 41, and what that could do for the community of Kettleman City. And we know that that junction does generate a lot of revenue for the county, and monies that come to the general fund on that. And I guarantee now more than ever in the middle of this pandemic that with the people who are obviously still traveling, that junction is helping the county out a lot right now. But when we start talking about marketing plans, I think the residents of Kettleman City, even though this is not labeled Kettleman City, I'm speaking to the impacts and the future impacts to Kettleman City and the footprint around the community, that obviously this project will have impacts to the residents. And so for for anyone who knows me and my thoughts on that area, I would look forward to hearing more about in the future, or if it's in the specific plan, I'll read through it more, but to have more discussions to pair up the marketing plan with an investment plan to the improvements of the residents living in that area, and improvements to the quality of life of the folks living in that area. And I'm not saying that the folks who are investing in this project here are responsible for the community of Kettleman City, but I'm talking about an overall vision out there. And so, some of my thoughts go to the connecting of the dots. So we have what's taken place in Kettleman City, with the latest being Bravo Farms, and that with this project.
Sorry,
No, I'll go ahead. I'll wait.
procedural. Item. Second reading, it's an ordinance.
Okay, good. Okay. Mr. Chair, I was talking about just talking about the overall bigger picture in the future as I'm excited about what's about to take place here and looking forward to it and supporting this, that if we have this nice development south of Kettleman City, and we have what's taking place at I-5 right now with Bravo Farms and the improvements it's brought to the area and the interest of highway travelers to stop in that area, if we're going to see a connecting of the dots from Bravo to this project. And I don't know what's in between there. Maybe it's private ag land, there's whatever's going on. If there's an opportunity for development between there, and we start seeing that, at some point, would that whole area be considered Kettleman City? Or what is the thought process of that? Because this sounds like this is an independent satellite development out there, and I'd like to learn more about that, the feature on there, and then I'll wrap up with this. For the folks, I don't know where they're broadcasting from. Very nice office space, by the way, though. For the team there with Mr. Lash, do me a favor. Back in August of 2009, the Hanford Sentinel ran a story, and the headline is, if you Google it, it's "Can Kettleman City Uncork Itself?" And if you read that, if you haven't already, you'll know where I'm coming from, where back in 2009, was private investors looking at an empty dirt lot there that today now stands as Bravo Farms. And so that article, that story I'm asking you to take a look at, covers a vision, and a vision that's there right now, where at that time, the biggest interest for highway travelers was In-N-Out Burger. And with the people, that would be the attraction for people to stop there to get the burger. But now, arguably, there's more of an interest there with the Bravo Farms now. So if you haven't even walked through the Bravo Farms development, I would encourage you to do so, because now there's more of an interest besides a burger and a tank of gas to stop in Kettleman City. That's what we want here at the county. And one of the things being the wine room. Stop in there. You'll be surprised. It's got the most beautiful wine room in Kings County, if not the San Joaquin Valley. Stop there, and you'll walk into a wine cellar where you can purchase wines from Napa Valley, Sonoma County, Paso Robles. Very, very beautiful. And so the point I'm trying to get to is that's what I would hope would be part of this vision, to beautify the west side of the County of Kings, and yes, to stimulate revenues for the county, but also looking for some plan with the lack of a redevelopment agency to capture some of this sales tax increment that will be generated to be invested back into the west side communities, because that's what I'm here for, and that's what I represent, and that's what I would look forward to having conversations with in the future with the Kings County Board of Supervisors. Thank you, Mr. Chair.
Thank you, Supervisor. Any more comments?
If there are no comments or
Yeah, before we have to, we're going to pull item D out of A, B, and C, D. Item D has to be pulled because we have to bring it back next week for a second reading, correct?
Actually, you would waive the first reading today,
Okay.
accept the introduction of it, and then bring it back for a second reading in order to
D or all
adopt
of
the
them?
ordinance.
Just D or all of them? Just the one.
Just D. The rest of them can be approved today.
Okay. So with that said.
Move is presented and amended.
A move by Supervisor Neves, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, thank you very much. Thank you, John Latch and your team for your presentation. And I want to thank Greg Gaska for his team and his presentation as well. I look forward to this coming together in the future and answering all our questions. So thank you. Appreciate it. Okay, we're going to go on now to board member comments and reports. So Supervisor Valley, you want to go first?
Yes, I'll be brief, Mr. Chair. I wanted to thank Mr. Lupavia. As I came in the office this morning, I saw that he left a nice certificate of election for myself and I believe Supervisor Fagundes to recognize as far as our re-elections that occurred earlier this year. Now that he did his part on the certification of elections, and I understand at some point it comes to us too, but I appreciate him leaving that. And I also want to congratulate Supervisor Fagundes on another 4-year term at this time. And so I look forward to getting sworn in January. I'm looking at the calendar. I see our first meeting in January is January 5th. And I would just ask that the clerks just take a minute, if they haven't already, to figure out a way to safely plan the oath of office as we regularly get sworn in. And so under the COVID guidelines, I know there's a way to get it done, and I look forward to us still having that opportunity to do so and do so safely. Thank you, Mr. Chair.
Thank you. Supervisor Peterson.
Yeah, not a lot, just, this whole shift in COVID responsibilities. And again, I just want to thank, all the employees here, but special shout out to our health department. This is just above and beyond anybody's expectations in how to respond to this monster. And you've been doing so for 9 months and just really appreciative of all your efforts and hang in there. Hopefully we get this vaccine, applied broadly and we're able to move beyond this time period. But that's it. Thank you.
Thank you, Supervisor Fagundes. Good. Supervisor Neves.
A couple of weeks, King's Waste and Recycling had our monthly operational reports, and we continue to work on evaluations of employees. The Hanford Christmas Parade took place at King's Fairgrounds. About a 45-minute wait in line, a 15-minute parade, but it was kind of neat. It was kind of be able to go through that, so it was all right. Lemoore raised their Christmas tree, joining Corcoran for the 110th time, having a community Christmas tree, and that was a very special event, a nice day. UCLA had a webinar training on December 1st, and and really when you look at that, the King's Partnership for Prevention does an awesome job with the dashboard and outlining all of the health concerns as well. The First Five Commission had a meeting also on December 1st. Presentations of audits and evaluations, a little bit tardy, but we got her done. And we continue to work with the Region 5 agreement that will have to come before this board whenever county council gets around to it, I guess. Calviva Public Policy Meeting, we reviewed the membership numbers as well as received reports dealing with health education, cultural linguistics, and medical management. We also heard the audit reports, and we're still struggling through the prescription changes to the program, and we'll continue to work through that. King's Partnership for Prevention had their prevention awards on December 3rd. It was a very nice event. Everything went through, and everything is moving forward. At the South Fork Kings special meeting, we welcome Michael Newton from Stratford Irrigation District, replacing Charles Myers, to the board, and wish John Lord well on his retirement, as he'll be leaving the city of Lemoore this week, I think. Also updated the budget to reflect the grant award and moving forward on many of those projects. The Kings County Library Winter Open House has been a long time event, and this year's going virtual. So they started November 30th. So get on the Kings County Library either YouTube channel or and watch that. Continue to Kathy and I sit in at the reverse parade at Lemoore as well. So with that, thank you very much.
I heard you put the Christmas tree up 110 times?
101.
101? Oh.
Lemoore did.
Oh, not you?
No.
You haven't been there 110 times?
No.
101 times?
No.
Okay, just checking.
Yeah.
Corcoran said last year they made a big deal. It was just it was going to be the last one for 100th year. And then out of nowhere, they put up another one.
Yeah.
And, I like it. I think it was good, especially after the way this year's went, that the community really liked seeing that tree go up. I didn't know it was coming.
Correct. Yeah, no. And I think it's good for these communities to do that. And
yeah. I'd like to echo Supervisor Peterson's thoughts on giving credit to our health staff. They're overworked and underpaid, and they're challenged. And there's no end to the outcome of what's going on. And it's coming to the holidays where we want to be by our families, and they're working overtime to keep everybody safe. I think Ed Hill's been here a couple of years now, and he's done a great job. I'd like to make a motion to bring back a performance evaluation for a salary increase for Ed Hill next week, if the board would like to do so.
I'll support entertaining the discussion if you need consensus.
Okay.
For that.
So we got a first by me and a second by Supervisor Valley.
Excuse me, Mr. Chair, you don't need to take a motion
okay.
if there is consensus to bring it back, agendize it and bring it back. I'm not hearing any objections.
2, 3.
yeah, no, and my only suggestion is we take all management and look at it. If we're gonna go through this process, why don't we look at all of them and do a department head management year-end review?
Okay. All right.
So I would hate to put any pressure on this board or any pressure on any department head, but I think it makes more sense to do a department head. I don't want to say evaluation, but review. And I know Henny can do a real good spreadsheet and have them all in the bands and all in their respective locations, and maybe even a time, because I think some of them, like Lance Lippincott, I think there are other department heads.
I agree. That's good.
Yeah.
I was just thinking under the terms, I would see myself in this position. It's the holidays, you got a couple weeks off. We talk amongst our peers in other counties, and someone says, Ed, you're doing a really good job in Kings County. How are they taking care of you? Can I get you over here? And then we're stuck with nobody. I don't want that to happen. I want people to feel appreciated.
Yeah, and I think we have several department heads on this campus that fit in that same category. So I rather than just go through the effort for just one, I think I would rather have a department head.
No, I agree. And then the board feels good about that? Greg,
Yeah.
okay with that?
If you look at Mr. Hill, yeah, he obviously looks, in my opinion, exhausted.
Yeah.
He looks exhausted, and if he's not able to take a vacation, then there might be some things for us to be able to talk about.
Okay. For goodness, you okay? Okay, we got 5 members. We'll bring it back next week. Thank you very much. At this point, we're going to go ahead and take it over to board correspondence. And Kyria, thank you. Welcome.
Good morning, board members. Kyria Martinez, administration. So in board correspondence, we just have 2 items. The Santa Rosa Rancheria sent a notice of finding of no significant impact for the Tachi Palace Casino Resort expansion project. We also received the California Water Board's meeting notice and agenda for the board Thursday, the 10th at 9 a.m. Upcoming meetings and events, we have the Public Safety Appreciation Event, which will now be a watch video event. A launch date is to be determined. And upcoming agenda items, next week, December 15th, administration has a few items. We have a COVID-19 update, Board of Supervisors schedule, board meeting schedule. We have an annual Williams report on schools, a master fee study session. The assessor's office has an agreement for petroleum property appraisal services. And also HR will be bringing a minimum wage item. December 22nd, we have administrations bringing reappointments to multiple board, SB 81 advertising. Behavioral health has a No Place Like Home round 3 notice of funding availability fund application, and public works will bring in equipment purchase. And that is all.
Thank you, Carrie. Upcoming events, you got that already? Okay, so, okay, we're good. At this time, we're going to go to closed session. Personal matters, government code section. Yes?
You,
Go ahead and do the other ones first.
you can adjourn this meeting to closed session. It will follow the Cal PFA meeting and the CalCHA meeting.
Got it. Okay, we're going to adjourn and go to closed session following California Public Finance Authority regular meeting, which will be next. And then right after that be California Community Housing Association regular meeting. And then we'll follow that with personal matters, government code section 54957, public employee performance evaluation, Idle County Council. Thank you very much. See you next Tuesday.
2 more meetings.
2 more. At this time, this is, I don't have that agenda in front of me, but I'll fake it.
It wasn't on the back of those other, look on the back of those books.
Which one do you need, Mr. Chair? You can have my copy.
I got them. I think I got them.
Which one you want to do first?
Took it.
Yeah.
California Public Finance Authority.
Okay.
So today is December 8th. It is 11:45, and this is a regular meeting of the California Public Finance Authority. Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Okay, all 5 members are present. We're ready to conduct business today. Item number 2, approval of the minutes from October 20th, 2020 regular meeting.
Second.
By Supervisor Fagundes, Valley, second by Supervisor Peterson. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley. Doug Verboon.
Guys,
Craig Peterson.
Aye.
Richard Fagundes.
5 in favor. We approve the minutes as presented. Item number 3, consent calendar. Consideration of approving an inducement resolution 20-081 for
I think that's
Jim.
I in it.
Huh?
Is that I or 81? We've had that problem in the
Yeah.
past. I don't know. I can't,
20-08.
I don't know if that's a 1 or an I.
Yep, neither. The one or I.
It's an I. This is Caitlin.
It's an I.
Aye, okay.
Yeah.
Yes.
For Jimco Development Partners, LLC, Monterey and Madrone, City of Morgan Hill, County of Santa Clara, up to $73 million in reverse revenue bonds.
Move
Item
as
2,
presented. Move the consent calendar as presented. Outline on agenda.
Yeah. Maybe as printed, not as announced.
Yeah.
you don't want to read them? Okay, all right.
Got it.
Second. Counter as written. Second. Second by Supervisor Nez. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Aye.
Craig Peterson.
Who?
Craig Peterson.
Aye.
Richard Fagundes. I'm talking too fast.
Been a long,
We have approved the consent calendar as printed, not spoken.
not pronounced.
And we'll move on now to public comments. Do we have any public comments? Do we have any staff comments? Sorry, I butchered up your consent calendar.
No staff comments today. Thank you.
Okay, thank you very much. Okay, we'll adjourn from California Public Finance Authority. And we'll open now as CalCHA, California Community Housing Agency regular meeting. Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Yes.
Okay, and at this time, all 5 members are present. We're ready to conduct business today. Item 2, approval of minutes from October 27th, 2020. Moved by Supervisor Fagundes, second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley. Doug Verboon.
Aye.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Okay, 5 members voted in favor of the consent calendar, of the minutes, and we'll move on now to the consent calendar.
Move as printed.
Moved by Supervisor Neves, second by Supervisor Peterson as printed.
Second.
And Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley. Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Is there any more comments we want to make from the public?
I'm the supervisor's favorite son, that's all.
Staff updates. Any updates from staff?
No staff updates today. Thank you.
Okay, thank you. Well, we'll adjourn and we'll go back to our closed session. Thank you very much.
Hi, Richard.
All gonna me? There you go. I'm seeing you in a long time.
Supervisor Valley, can you hear?
Yes, sir. Yes, sir.
Okay. Good afternoon. Today is Tuesday, December 8th, 2020. This is a Board of Equalization special meeting. And Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
5 members are present. We're ready to conduct business today. Unscheduled appearances. Do we have anybody on the phone today with a hand up?
No hands up and no notes from by email.
Item number 3, regular agenda items. A, consider approving the statement of decision application for change of assessment 18-009 and 19-008 filed by Charles and Jamie Kuhn, Revocable Living Trust. Board, what's your pleasure?
I would move for adoption.
Motion moved by Supervisor Peterson, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Supervisor Nevs.
Yes.
Supervisor Valley.
Aye.
Supervisor Verboon.
Yes.
Supervisor Peterson.
Aye.
Supervisor Fagundes.
Yes.
5 in favor. We have approved the item as presented, and we are now adjourned. Thank you very much. Okay, good luck, Craig, with your doctor.